Preethi, consultant, Dr. Mohan's Diabetes Specialty Center, JP Nagar, Bangalore. So what's special about JP Nagar Diabetes Specialty Center? The center here at JP Nagar is quite a comprehensive care for diabetes under one roof. We have a lab attached. We have facilities to screen eye, the nerves, the kidneys and various other blood tests. We use of ambulatory glucose profile, also called as AGP. This is in the form of a freestyle Libra that we usually affix on the back side of their arm. What this glucose monitoring device actually does is it calculates your blood sugars every 15 minutes, and at the end of 14 days we would get a median graph which would clearly say us or show us the glucose variability throughout the day. So it's so important that we had a patient, the patient profile was like the patient was around 79 years of old. That man had repeated low sugars in the midnight, which none of the doctors were able to diagnose. But as he came to our center, I made use of the AGP, and it was so important that he was getting low sugars as low as 40 milligram per deciliter in midnight 3:30, and we tried to reduce his insulin or the medicines in the previous night, and in the course of 1 week there is a dramatic improvement in his glucose control, and through the AGP at the end of 14 days I could prove them that the low sugars were totally improved and he had a very normal and healthy life. Important case that I had at Dr. Mohan's JP Nagar was that a 25-year-old guy came to me with very high blood sugars, but we at Dr. Mohan's get a pedigree chart, that is a complete family tree. So when we had a look at his family tree, we could see that 3 generations of the family are positive. So as Dr. Mohan says, when 3 generations of diabetes is positive and the patient's insulin content is quite good, we should usually go to the diagnosis of what we call as the maturity onset diabetes of the youth. So what I did was just a 5 ml sample, and this sample was sent to Siruseri, where it took around 2 months for his genetic testing, and he turned out to be something called as the MODI 3. So the treatment protocol says that we can use only one medicine called as a sulfonylurea. We initiated him on bibenecamide, and the person who was more on insulin and many other medicines throughout the day was put on only one medicine and could make changes within 2 months, and his A1C dropped down to as low as a pre-diabetic range to about 5.6. So this was an amazing improvement that could see in a patient. So I would advise all the youngsters out there, whoever have a family history, please come down and get your screening test at the earliest so that you can be free from diabetes and lead a very healthy lifestyle. So when we look at the risk factors for diabetes, it is a multifactorial disease basically. So it could be change in your lifestyle, your genetics play a very important role, your physical activity, the amount of physical activity that you do, all these matter, along with other comorbidities like hypertension and dyslipidemia. So we'll have to take care of all these risk factors, and if you have a strong family history, it is wise to get your screening done at the earliest. Previously, it was said that any person who is above the age of 40, but it has come to as close as more than 30 years. So if you are above 30 years, if your waist circumference is more than 90 centimeters, or you lack in physical activity, it's high time that you walk to our clinic at JP Nagar, Dr. Mohan's, and get your screening done in the form of an oral glucose tolerance test, which is very useful.